Assalamualaikum. In this video, I am discussing about gastrostomy tube consent. So it is very frequently come on exam. 2023 Jeddah come, also 2024 it comes. So normally the task is that is a cerebral palsy patient who need gastrostomy tube, new planning because he pull the NG tube. Okay, do not forget the stoma nurse. Remember, we will tell the nurse in this scenario. So first of all, this picture we will draw. That is how gastrostomy tube placement we will tell. Then I know you are such a keen mom. First IRCAP, we know everything. I know you are such a keen ma'am. I know you are doing such a great effort taking care of your child. I know it is not easy to take care of a CP child, but you are doing your best and I really admire your efforts. Okay, thank you, doctor. I am here to take a consent from you to do a gastrostomy tube for Ali. So what is this gastrostomy tube? It is a tube from the skin outside to inside the stomach through which we can feed him and give him medications. So look at the stomach, it is a tube. By that we can give both feed and the medications. Is it a surgery? Yes. It can be done either by open surgery or keyhole surgery. So what is keyhole surgery? It is an endoscopic surgery. Why he need this tube? So this tube is needed because he is to be able to feed him and give him his medications. Is there any alternatives of gastrostomy tube? NG tube will be alternative, but as you said that he is pulling it out. Ali, are you with me? So what are the drawbacks, doctor? What are the drawbacks of gastrostomy tube? Drawbacks of sleeping medicine, pain, bleeding and infections. So pain, bleeding and infections, say the problem and the solutions. So also there are some temporary drawbacks. There is a risk of obstructions. But if this happen, first of all, you will do the massage of the tube between your two fingers. If it did not work, you can get a 50 ml syringe and fill it with warm water and try to push and pull technique. If it did not work, you can use carbonated water preparations. After that, if still not work, you should seek medical advice immediately. Are you with me? So first we will massage by two finger, not working, giving 50 ml water by push and pull technique. Then after that carbonated water, if not working, then seek the medical advice. Next, another complications. Also there is a risk of dislodgement, and if this happen, you will put the NG tube in the opening, then go to the emergency room immediately. Am I clear so far? So if there is dislodgement, we will be go the emergency room. We just put the NG tube with this hole. Okay. Then another complication, it may be there is a risk of leaking, but we will use the skin protection cream, and if still leaking, you should seek medical advice. So there is leaking, can be skin protection cream we will use. Yes, doctor, but I do not know anything about how to care of the gastrostomy tube. You will not leave this hospital till we have a meeting with a specialized nurse who teach you everything you should know about care of gastrostomy tube. So specialized nurse, that is, we will mention that we will teach you before you leaving this hospital. We will give you everything. Also YouTube, this leaflet we will tell. Okay, how to feed him through this gastrostomy tube. The procedure is that we have two types of feeding, continuous feeding and the bolus feeding. So continuous by using an electrical pump, allowing certain types of food to go to in the stomach over a period of time. Okay, so it is a electrical pump over a period of time it will go. But bolus feeding by special syringe, you will put a semi-solid fluid and you will push it through the tube and then to the stomach. So one is continuous feeding and one is by bolus feeding. Then what about the hydrotherapy? Once the stoma is healed, he can do hydrotherapy, take shower and swimming. How can I give him tablet through this tube? Tablets should be crushed and dissolved in water, and after that we can give him. So after all the discussion done of communication, we ask that. So are you agree with our plan about gastrostomy tube? Because here we are to take the consent. And as usual, we will summarize trusted website, leaflet, support group. If needed YouTube video, these are we will give it. Thank you.